Unshelling Medicine Podcast. Healthcare in the language we understand.
Hello, welcome everybody. Today I have the pleasure of talking to Dr. Evelyn Higgins today. Hi, Dr. Higgins. How are you?
I am wonderfully dangist, close.
We're getting there. Thank you for being with us today. So before we got on the call, we started talking about very juicy topics.
Yep.
However, we're going to share with the general population, where we started. So I would like for you to please just talk about your experience, how you got started in medicine and where we are today and your experiences. I think that would be great.
Sure. So some 30, I'm just sitting here trying to figure it out, maybe 35-ish years, 36 years in practice in physical medicine, integrative physical medicine. And I was seeing people starting to become dependent on meds because of pain. And I was in a rural area. So I thought, well, maybe it's the rural area and we don't really have the resources that an urban area would. And then 20 years after that, practiced in an urban area and it was the exact same thing, except people were going from dependent to addicted. And that was my professional life. In my personal life, I married a man who was an alcoholic, who had really several addictions. And a year after our daughter was born, found out that he was adopted. And we knew nothing of his health history.
Wow.
And I'm seeing these behaviors in him with, obviously, as a mother, concerns of what do I need to know for my child? So started learning everything that I could about addiction and mental health and just kind of took me down a different path. He wound up dying at 42. I'm 64, so that was a long time ago. But what I was seeing was that we weren't developing any new technology, any new diagnostics, any new way of treating patients in mental health and addiction. It was like it was 1950. Right. Nothing had changed and everything was based on vocabulary. So if someone said, I just don't feel like I used to. I don't want to get off the couch. I'm really down in the dumps, Okay, well, here, take this antidepressant. And I give my disclaimer early. I am not anti-pharmaceutical, right? They save lives.
Right.
But the problem is that we abuse a lot of them rather than use them. And SSRIs are the perfect example of that. Antidepressants, which were never created to be for a chronic situation. They were created for an acute situation. And in fact, we didn't even have the data to support what it would look like if someone stayed on for 10 years, now for 20 years, now for 30 years. We didn't know what that would look like. Would there be adverse reactions? What would change? Because, your liver, your kidneys, your bladder all have to support that. So I'm seeing nothing changing. Just someone's diagnosed on vocabulary and or observation by someone or themselves, and that's it. And all of these other parts of healthcare are rapidly evolving with diagnostics, with technology. And in this area, somehow it was, especially in the addiction space, was somehow like you got yourself there, you can get yourself out of there. And so much was changing, so much was evolving. And then I went and got a diplomate in addiction and compulsive disorders. And I'm like, we're at a standstill here. This is ridiculous. So really, I did 18 years of R&D into what we do today with our lab, which is looking at genetic biomarkers for mental health, for overall wellness, for addiction and all the things that we have to look at, because it's not just, okay, well, you have this one particular gene. No, It's all of the other parts. As you know, being a professor of nursing and medicine, you understand like inflammation is going to have a part in it. Detoxification is going to have a part. Autophagy is going to have a part. Does vitamin D work in the biochemical pathways of this individual? That's going to have a part, right? So it's not, we want to, because we're used to here, take this, we want that to be such a simple answer. And the great conversation that we were having before we even started this, I said, there's 8 billion people in the world with 8 billion different sets of DNA, yet we're treating everybody exactly the same. And we're wondering why we're not getting the results.
Absolutely. Absolutely. It's an alignment because I just had this same conversation today and SSRIs came up and SSRIs are Band-Aids, right? The way that our healthcare system is set up is that is very much a line item system, right? Is very much about the claims. So the time to actually interview a patient for that assessment, right? That in-depth assessments to understand family history, personal history, environmental effect, right? Environmental can be your work, your home stressors, even the difference between somebody who lives in a rural and an urban area, right? Adoption, right? We don't have a system that really tolerates that in a way that supports practitioners who are willing, right, to support patients in that regard. So I'm leaning a little into insurance. The one-size-fit-all approach does not just, yes, the pharmaceutical industry has that. I think it's convenient, to be honest with you. It's convenient. I can walk into Walgreens and I have a headache and I have a choice between Advil, acetaminophen, I call Advil by brand name. I'm sorry, guys. But, I can walk in and have choices, right?
Right.
However, how does that work for me as a person, right? My makeup, my DNA, how is that medication metabolized in my body? Now, the old school walk in, talk to somebody and have something, specially mixed for me is gone out the window because of the convenience. And, fast food is not the only convenience. You think we can ever get back to a place where not only the pharmaceutical industry that we have, but also insurance and the end of insurance thing. Insurance can also support that level of treatment that is very individualized, because we talk about individualized plan of care in a general setting like a hospital during an inpatient stay. But long term, yes, we put something in place. The other aspect, of treatment. Do you think we'll ever get to that place where insurance covers the nutritional specialists, the energy healers, and integrative medical practitioner who delves into those metabolic needs like, your B12s or your B vitamin or your magnesium level?
Right. And that's a great question. And to the positive side of things, we had one of the largest insurance carriers in the country come to us. We didn't open any conversation with them. They came to us, which is unheard of.
Wow.
And they said, we have X amount of data. We want to prove the efficacy of this because we know it works.
Right.
We want to prove it because then if we say, hey, we're going to cover this, the other guys have to just to be competitive.
Right.
And at the end of all of it, it would actually be less expensive, which is all the insurance company cares about. Right. It would be less expensive because you're going to eliminate so many things that could be eliminated by understanding the genetic makeup of the individual. So precision medicine can be here. It is here.
It is.
Are they going to cover it? It's dollars and cents. And if they would realize they would actually save money by doing it, I think we're going to see some changes. People always ask me, like, I do a lot of media and they'll say, well, what do you want to see at the end of this? I'm like, I would love to see it just like a CBC. Mm-hmm. Every year you go to your primary, your PCP, they do blood work, right? Well, this is only you have to do it once because it's your DNA. What changes is the epigenetic expression, right? But your DNA is your DNA. We're changing the expression. So it has to be done once. That's it. But doesn't it make sense for that individual to know these are my strengths, these are my weaknesses, this is what I can do to support and optimize what I have so we prevent XYZ from happening? Or if we know that I can't metabolize whatever pharmaceutical it is, let's not wait until we have the adverse reactions and I die. Let's know that before. I mean, this is common sense.
So, talking about taking inventory of these things, we do it every day, even in appraisal. When we do employment appraisal, every year you go in and, you have your review on what areas to improve. And it sounds complicated, but it's so simple. And sometimes even the testing processes of it, I've had a few people come on this podcast that are in the wellness space, the nutrition, exercise, and weight loss space. And this is really gaining traction in that industry, where personal trainers or weight management experts are using this genetic testing to actually tailor plans. And there has been marked improvement and targeted treatment. I don't want to call them treatment because they can't really treat, but there has been targeted interventions that have shown great results. Right. Is there a way of, because this is science, right? We had a reason why we got into this industry. We're very evidence-based. And for anything to be approved on a general scale, usually we look to CDC or we look to the FDA or we look to, the bigger bodies.
Right.
And usually it's very controlled in a sense. Mm-hmm. Is there a possibility of widening that mirror or that looking glass just a bit to look at the other complementary healthcare and wellness services that are actually showing results?
Right. My optimistic side wants to say, yes, we can get there. I think it's going to be in baby steps. And at the end of it, it's always going to come down, do we save money?
Yes.
And when they figure out, yes, we can save money, I think it's going to open more doors. And I think it'll be a slow progression.
Okay.
But I think it'll happen. I think it can happen. And I think really the public is going to almost demand it at this point. Really with the advent of so much information being available to the masses. I mean, back when I was a kid, you didn't have access to the information that the doctor had. You couldn't go to Dr. Google and put in, whatever and come up with, that can be dangerous too. But there's access to so much more information, I think the public demands to move forward. And when the data is there to support it, how do you turn your head and put it in the sand? This is, as you said, it's science. It's scientific data. It's data points. It's biomarkers individual to this unique person.
Yeah. So, the good and not so good side of Dr. Google is that, yes, it is educating people. However, not all the information on Google is clinically sound.
Yeah. It's a nightmare.
It is. And the thing is that people usually take this as a sword to go into a fight. For the people that are bold to do it, and, kudos to you, because not every patient is that bold to stand up for themselves. And please, you're in the driver's seat of your care. If you haven't heard anything from this conversation, advocate for yourself.
Yep.
Which leads me to my next question, Dr. Evelyn. Do you think it will be of great value for those of us who see the benefit of integrative medicine in modern healthcare to sound the bell, because I don't want to call it an alarm because it's not, sound the bell to our colleagues, also empower patients, that everyday people, right? I don't just want to say patient, everyday people who are recipients of healthcare, to equip them with knowledge, valuable knowledge, not just anything. So that when they're advocating for themselves, they're speaking from a place of knowledge and authority.
Yeah. And you should, you have to advocate for yourself. And if you can't, have somebody do it with you and or for you. But this is what we do in looking at someone's unique biomarkers, is actually give the power back to you, the individual. Because we're not guessing anymore. We're not throwing a dart hoping we land someplace close. And whoever you are, we may work harder and not as hard. You have the information. This is me, right? And with that information, and this is where some places stop, it just becomes useless information if there's nothing to do with it, right? But what we do is look at the biochemical pathways of every place where we have what we call a polymorphism or a variant in that gene and say, okay, within that biochemical pathway, what do we need to do to optimize it for this individual? That's where the power lies.
Right.
Right? We can prevent so much.
Right.
We can change so many lives for the better. We all still have free will. We
Right.
can do what we want with the information, but it should be available.
So in case of addiction, since it was one of the main topics that we started off with, in terms of addiction, and how important is it for a person to understand their family history? Because we've talked about the genetic and epigenetics of things, right? And if you don't mind, just delve a little bit into genetics and epigenetics.
Sure,
While
sure.
you're explaining this, I would really appreciate it. How important is it for a person to understand their family history, especially as it relates to addiction and how that can manifest in themselves?
Sure. Extremely important when it comes to addiction.
Okay.
Addiction and mental health, there's over a 50% congruency with genetics. Whereas in overall health, 10 to 33%, mental health and addiction over 50%. And this is backed up by huge NIH study of over 1 million people. So this isn't just, here's a one-off conversation. There is plenty of data to support this. So before all we had was, it's a family get together. We, whatever holiday it is. And we always see Uncle Joe just throw back a couple too many, usually falls on the way out of the house. That's what the family would be like, ha, 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 right? Mm-hmm. But that was as far as we could go with, there's a couple, there's this, that, and the other thing, especially in this area, because there is such a high correlation with genetics. We need to know it. So your DNA, you're born with your cards. Mm-hmm. Here they are, play them out. Most fascinating part of science, I believe, is going on today in the study of epigenetics. Because we now know your DNA is going to stay the same. What changes is the expression of your DNA. That is the key. And that is huge. Like I'll have a parent say to me, I never saw this child. They came to us. There were problems. For 20 years, never saw this behavior in my daughter. 21, everything changes. My first question is, what happened in the last year? Where does she live? What is she doing? Well, she went off to college for the first time by herself. She's now making her own decisions. She's trying to do a schoolwork. She's trying to hold down a part-time job. She's probably not sleeping much. Right. She's eating whatever on the run. She's got a whole new group of friends. Everything in her environment has changed. Those genes were always there, but we didn't see them show up because the environment never changed. This was the first change in her environment. Now we saw them show up. Right. Well, wouldn't it have been much easier to know in this conversation with this child of like, hey, you know what? Your buddies are going to start doing things. Right. They're going to say, come on, we're all doing it. It's no big deal. You have the predisposition here for this to just overrun your life. Right. The next day when they say, no, we're not doing it today. Nah, we did it. It's over. You're like, no, I want to do it again. Because you are wired differently. Your DNA is different. And that's so powerful. And I can't express enough how important it is in the area of mental health, in the area of addiction, to know with fact, more than Uncle Joe has too many, what you're dealing with. Because we can change it. Yeah. And it's like that trigger. Nobody plans for it. Nobody knows exactly what that trigger is going to be. It can be a loss of a friendship or a death of a family member or just not getting that grade you so wanted in that particular class. And nobody ever has a finger on that trigger, but understanding that, yes, this trigger is here. Watch out, right? Just be mindful of it. So if it goes off or before it goes off, you know how to basically step in front of it. Right. And that is the preventative aspect of things that it's so interesting. It gets me excited. I got really excited at the beginning of this conversation. Yeah, it is exciting.
It's so exciting. And also the other part, it's, the correlation you made between, addictive cycles or presentation and mental health going hand in hand. It's kind of like when, people say all of a sudden this person has a psychotic break.
Right.
Is there a family history of somebody having a psychotic break around this age,
Right.
around, certain things happening? And it can take the guesswork out of things. Where's your stance or experience on addiction showing up in different ways? Because when we talk about addiction, the default is usually alcohol, drugs, right? Can addiction or an addictive personality that is DNA based show up in different ways? So
Absolutely.
gambling
Absolutely.
okay.
Gambling, sex, porn, shopping, food. Absolutely. Really, it's the setup is there within the DNA. The expression is there. And then it's what you happen to be exposed to when you are at that vulnerable spot. So let's say for somebody, it's, I went with my friends to Vegas. They were like, oh, let's get out of here. I lost too much money. You're like, no, I'm staying till I win everything back. Right. So all of that is an addiction. All that I just mentioned, it's what makes you feel, oh, this is it. This is the it. And for some people, it's addiction swapping, so they go to rehab and they stop drinking and then they come out and they're doing XYZ,
Right.
just replacing the addiction because it's about trying to satisfy that dopamine, trying to satisfy the COMT gene, the GAD1 gene. It's about all of those things. And whatever you find to satiate yourself is where you're going to go. And it may be all the places. We'll just jump around.
So I'm curious, and please, this is for me to educate myself as well, especially when it comes to addiction. I haven't experienced in my 15 years in healthcare that somebody completely does not have a replacement for an addiction. So I've seen people who stop smoking gain weight because they need that, hand to mouth satisfaction. People addiction swap very commonly. Is there a way that, somebody can go through a treatment process or program where that switch is, flipped? That addiction is no longer, there's no need to satisfy that aspect of themselves?
Sure. That's exactly what we do in the work that we do, because we're looking at what's the root cause of the need to go outside of yourself to find something to feel better in here.
Okay.
And it can just be fill in the blank, right? But it's always we figure out from the biomarker approach, which ones?
Right.
What do we have to address?
Wow. So that's very interesting. So, wow. So how is that treatment program? Is it, do we utilize, I know a lot of people kind of like use hypnosis and things of that nature, or desensitizing to whatever it is the causative factor is. So how is like going through that process with somebody?
Sure. So we start out with the lab work, obviously.
Okay.
We need to know where you're at, what is uniquely you.
Right.
And then from there, we create the protocol, the recommendations for what we need to do. And then people either, depending on how they want to do it, we work with people all over the world. We drop ship the lab kits to them. They do their buccal swabs. They send it back to us. We create the report. Either we then go over everything. I mean, we go over line by line of 85 biomarkers. I mean, like an hour and a half kind of thing. Okay, here's what we suggest. Here's what we do moving forward. Here's the phases in this time. Some people be like, I can do this. You gave me everything. I'm going to run with it. Some people say, okay, but I want to work with your counselors as we go through this. And we do that as well.
Okay.
Because once we've made the physiological changes, we still have to work on those emotional pieces, those habits that we've created. So we know that physiologically, we're now in a different place. Okay, now the habit needs to change.
My mind is completely blown. So
yeah, good stuff. See, this is the using what's available in science and technology to put it into this aspect of such a needed space.
It is needed. It is absolutely needed because, can you imagine this being available to a lot of people who have habits that unfortunately has caused a huge amount of debt.
Sure.
You
Yep.
know, financial ruin,
Yeah.
have lost relationships,
Yep.
have lost, their lives, unfortunately, when there is a lot to work through it and actually address it ahead of time. So again, we're talking about addiction, right? Addiction is not an easy thing to break, is a lifestyle change, is addressing the uncomfortable. How difficult it is for somebody who has an active addiction to go through the process.
It would depend on the addiction, because actually alcohol can kill people if they're trying to go through a withdrawal on their own without any support. It is the most dangerous. So it's case by case. It depends on where the person is at within their addiction, that we suggest either, okay, it's going to be enough, start with us and let's go, or you need to go to detox for 3, 5, 7 days, depending. Come out of detox. We can even do the swabs while you're there to get us started, so we have everything ready to go and move on.
For people that are being proactive about it, given maybe family history, or specifically family history, because that's the only thing that I can think of, is there a way of making it more of a communal healing process as opposed to just focusing on one person? Because the reason I'm saying that is when a person is actively going through sobriety of any kind or going through treatment of addiction, their community, immediate community, family members,
Right.
have a big impact on that.
Right. Right. We also offer support systems, and sometimes there's even family reaching out to have us do an intervention.
Okay.
So it's all case, but there's no like, here's what we do, flat out. It's what does this case require?
Right. And talking about interventions, the person has to actually be tired and acknowledge that there is a problem.
Yeah. Be willing.
They have to be willing and acknowledge that there is a problem.
Yep.
In a case where somebody doesn't think they have a problem, because most people with addiction don't feel they have a problem, they play it off as, it's not that bad.
Mm-hmm.
How productive is an intervention at that point if the person is not acknowledging that there is a problem?
If they're not going to take the step of action after it, it's a conversation. It's nothing more than that. The goal of the intervention is to have those conversations, to have the people that have respect from the individual, to hear of what they're saying, see happen to the individual, what it's doing to everyone else's lives around them, to motivate them to take action. If that person doesn't want to take action, it's just a conversation.
So what would you say to family members who have a loved one with an active addiction, whether it's to drugs or to habits,
Right.
Yeah.
If they wanted to do an intervention, what I'd suggest to people is get together a handful of people in this individual's life with the addiction that they're going to hear what they say. They respect them enough. They may not be, because you said it, I'm in, but there's respect there. And they hear how it's affecting them, be it their children, their spouse, their best friend, grandma, whomever, and have them be at this intervention ready to say, here's what I see happening, what it's doing to all of us. We love you enough to be having this conversation, because you're going to kill yourself. Your life is going to be over. And they don't want that to happen. We don't want it to happen. And motivate that person they all know that this isn't normal behavior. It's, do they feel like there's anything different? Is there any hope that life could be different? If I ask somebody, tell me how you see your perfect day, and it's getting high, we're going to have to work through, why is that a perfect day? Because you're killing yourself. If someone who's still an addict but wants change, what's your perfect day? Well, it would be sobriety. If I could only get there. They don't know how to get there. And that you could have a life. To me, this thing that we've been given is a gift. And we don't know when it's over. Every day we try to play out that gift. if you can't see it as the gift, we have a lot of building up to do to get to that point of, you know what? There's people trying to hold on to life every single day, and you're ready to give it up every day. Some people, they've never had anyone have the hard conversations with them because everybody's like, they're lost. I'm not wasting my energy. That makes somebody feel like they're worthless. Or if they tried, maybe, we'll go back to the mental health example. They tried an SSRI, they didn't get anywhere with it. So then they tried another and didn't get anywhere with it. I'm hopeless. I'm a clinically depressed person and I'm hopeless. No, nothing could be further than the truth. We haven't done enough digging to figure out the why behind it. That's the same for the addict. What within you keeps this going, right? So now we have the ability to look at this information. It's a game changer.
This is so incredible. We've talked about addiction that have an impact, right? Physical health impact and impact that everybody can see. How about those insidious addiction that, unless it is communicated, most people don't know about? Pornography was brought up,
Yep.
right? So some people, well, what's wrong with watching porn, right? Mm-hmm. So what are the effects that an addiction like that can have on an individual?
Well, the individual feels shame and guilt, but is going to wrap that around another story. But the bottom line is shame and guilt. It's going to sever their relationships. Addiction with sex, be it porn, be it constant cycle of adultery, is very difficult and destroys families. It's not just you, it's anyone in your sphere. Is destroyed. And oftentimes because you don't see the person drunk, you don't see the person high, they hide it. I mean, I've had patients that have had literally affairs for over 40 years. And it wasn't until they got caught that they said, yeah, maybe this is a problem.
It's the same person?
Yes. Yeah.
Okay.
Yeah, absolutely. And more than one. And it was only when they got caught that it was, I better do something. It's usually because it's typically more males that we treat in that area. There are women that have sex addictions, but the numbers are definitely more male. And it's typically to hold on to a marriage and or children and or I've had some extremely successful, prominent people where they're going to lose it all.
Yeah.
So all of a sudden, I need some help. But for the 20, 30, 40 years prior, you were good to go, and at the end of it, because we're now looking at science, because we're now looking at literal data points and biomarkers, it's not a moral flaw. Yeah. Nobody wants to mess up their life every day. Nobody says, you know what, today I'm going to lose my family, my spouse, my job, my home, all of my savings. Nobody does that. It's not a moral flaw. It is a disease. And until we start to take it under the umbrella of healthcare and that it's a disease, it's going to continue this, take lives. And if all we care about is the cost to society, the cost to society is huge.
Wow. So I'm very excited about this conversation because it's much needed. We have a way of suffering in silence, and sometimes it is not by choice. It's because of, what you stated, morality and societal outlook and judgment. So I have patients that I've had the pleasure of working with that do hide things because of the feeling of being judged or reprimanded by their providers, right. Especially around holistic care, having acupuncture on the side or sound healing or Reiki and all this. So I don't think my doctor believes in that. Right. And, so you'll smile because
Yeah,
so to know that there's a need, because hopelessness, you mentioned hopelessness.
Yep.
Hopelessness is one of the primary reasons why people complete suicide.
Right.
And to know that there is hope and there's a way people can be helped, especially if they've tried everything, because people do try. right?
Yep.
And
Yep.
even with that, there's still a lot of stigma around that.
Absolutely.
Where do we go from here as a society? How do we understand that for somebody to get to the point of feeling that there's no way out, that it really takes a lot of heaviness and burden?
Sure.
How can we, better understand that this is not, it's anything but a way to give up?
Right, right. Well, first off is the conversation you and I are having, right? To openly have these conversations and to understand that it's health. Mental health is health, right? It's not different. It's not a subset. It's still health. And it's a condition or a disease that has to be addressed. And we have to keep on working at it until we address it properly. And now being able to look at somebody's genetics and say, we've been missing the mark this whole time. No wonder nothing worked. No wonder you never felt better, because we've been throwing a dart.
Yeah.
Now that we can do those things, I hope it gives your listeners hope, because it doesn't have to be there. I did a TED talk about addiction, understanding the biomarkers of addiction. And in there I said, using the addiction example, that it's not a moral failing. If someone had diabetes, we aren't say, why are you so weak? Stop eating that.
Right.
Right. But someone
People
was
say
addiction. Sometimes they do. Sometimes they do. But with addictions, for sure, they're going to say, just stop.
Yeah.
And the person's like, if I could, I would, because no one wants to ruin their life. You don't wake up that day saying, today's the day. Can't wait. And we're at a time in society where the number one killer of young adults is death by suicide.
Yeah.
That, on so many levels, speaks volumes as to what we're doing is not working. And if it were working, you and I wouldn't even be having this conversation, because it would be a futile conversation.
Mm-hmm.
We wouldn't change a thing. But it's not the case. And the definition of insanity, right? Doing the same thing over and over again with the same result. That's what we're doing. And we're having conversations about all these other things, but the one we need to have, because it makes everybody uncomfortable.
Yeah.
But if we start out with knowing there's a different outcome possible, because for the first time, we have a way to look at the root cause rather than all the other parts. As you said earlier, an SSRI is a Band-Aid. And yes, there are times in people's lives that life is hard. And you need something to just get you through that, but not to live on in perpetuity.
Yeah.
That's where it becomes problematic.
So since we're on SSRIs and the pharmaceutical way of things, again, the drugs within that category, I should say, were, I don't want to say invented, were, placed for a reason, right? Again, to get somebody over that hump while we figure out why this is going on. And while we're on the topic of DNA and epiDNA and understanding at the very basis of what makes a person, when it comes to metabolism, what are those check marks? What are those boxes, right? What are those triggers, right? On the clinical trial aspect of things, right? Before the medication that we all use that help us in different ways is pushed to the market, is go to market ready. Utilizing this very intently, wouldn't this be useful for all of us?
Absolutely. Just to use that example of the SSRI, one of the genes that we look at can tell us if an SSRI is even going to be effective for you with your DNA. Well, think about the amount of people that go to their doctor, no harm, no foul to the doctor. They're trying to do their best.
Absolutely.
But the tools that they have to use within the time parameters that they have to use those tools is ridiculous. And the individual is on one SSRI, goes back, no good. Well, let's double it. Let's half it.
Yeah.
Let's change it to this. And how many times is that done to no avail, to where then the patient becomes the problem?
Yep.
And they are labeled problem patient who doesn't want to be any better. What does it do to the emotional state of that individual? Give up. right? Give up. There's no hope for me. When no one took a deeper dive to know that that SSRI was never going to work for you. We have to figure out a different way.
And to think that this is not an ongoing test. This is a one-time test.
Yep.
One time, right? We go to the doctor yearly for annual physical. The CBCs are drawn, the BMPs are done, and then this panel, that panel, the other panel. And, I just had a surgical procedure, all this imaging tests back and forth to know that if I'm predisposed to, I had a ganglion cyst removed.
Okay.
If I'm predisposed to ganglion cyst, okay, one of my DNA markers is just growth of benign whatever, right? And I know to expect this. I'll be on the watch out or the lookout for something, right?
Right.
More on the preventative side of things.
That's where I was going to go, or perhaps prevent.
Yes. More on the preventative side of things. That way, my doctor doesn't have to reach out to the insurance to have a pre-approval for an x-ray, an additional MRI, or to get IV fluid when we had the shortage of IV fluids because I'm preparing for surgery.
Yep.
If there are things to prevent that, if I can modify my diet, modify my lifestyle. So is it wearing shoes that are, a little looser than form-fitting because it might just irritate those tissues to, decide to say, we're growing something, right?
Yep.
People are predisposed because of, again, those markers.
Yep.
And if we do this one thing that a person can take from doctor to doctor, provider to provider, insurance, you can save money. Doctors,
save money.
We can
save money.
Right. It's all about the money because healthcare is a business. I get it. Okay. It is a business. However, it's super businessy these days.
Can I quote you on that?
Please do. It's super businessy these days when it comes to, the constraint of how many minutes a doctor can spend with a patient. And if everything is right there, we are moving into an era that even the EMR systems are super integrated, right?
Mm-hmm.
Right. So if something was done within the same hospital or healthcare system, these results are right there at the tip of our fingers. It will help really curtail and a lot of this trial and error when it comes to treatment.
Exactly.
Right? And, we brag about an individualized plan of care. This is it.
Yeah, absolutely. Look at what you did on today's podcast.
Dr. Evelyn, it's so, it feels like a fantasy, but it's not.
It's real. We do it every day. That's what we do. Yeah, that's what we do every day.
So, okay, so your colleagues in healthcare, what is the one thing that would make this so beautiful that we can all work together? Because this podcast is really about having these conversations to really emphasize that we can all coexist and make the impact that we want to make.
Absolutely.
Right?
And make each other's jobs easier with better outcomes. At the end of all this, it should be about our outcome. And we're going to have a better outcome as a result because everybody that's involved in it is going to have more precise information with a better treatment plan because it's precise. We're going to eliminate a lot of try this, try that.
So what's stopping us? Is it like, do we feel like we're being replaced or, this is the way we've always done it? Because I've heard that.
Pretty much, in science, like 15 years is, this happened this morning, is 15 years, right? It takes a long time to get people to think a different way. And especially when people have been trained extensively in one way to think, to get them to open their minds to say, we've got new information supporting this. Some of them will jump on. A lot of them will say, this is how I practice, cut and dry every single day. This is what I do. Nope, not changing. Other people are going to say, oh my gosh, how can you not? This makes so much sense. And it takes time. It takes time. But that's why, I do a lot of media, and it's to get people to say, hey, you know what? This is available now.
Right.
And it wasn't before. It's a game changer. Perfect to me would be you have this done early in your life.
Yeah.
And you know all this going into the game of life as you make your decisions and or life happens.
Yeah.
You know how to respond. We've got more like hurricane and tornado plans than we have what we're going to do to prevent disease and conditions.
Well, we can see that one, Dr. Evelyn. Obviously. It's so silly, but it's so real. So when it comes to health, we move slow because we want to see that it works. Okay, but this works, right? It's basically the basis of our practice. Do you find that the older generation of medical practitioners are slow to change in comparison to the newer doctors and medical practitioners, or it's kind of depends on where the person is located?
I think it depends. Regional definitely plays a part. Education level of the patient base plays a part because they're going to demand more the greater the education. I learned about this. I want this. Wow. But I'd say blanketly big picture, the older practitioners are set in, this is how I do it. I'm not changing anything. I'm 5 minutes from retirement. I'm staying the same way. Younger people have more, they still have more of the, we can do so much good. Let's go get them.
Right. And you see more and more of the younger generation embracing integrative aspect of things.
Absolutely.
Okay.
Absolutely. Yep.
Which is beautiful. That's good. That's good to hear. That is really good to hear. Yeah, this is exciting. So if somebody wants to reach out, and I don't know why they wouldn't. Hello. Okay. If somebody wants to reach out to you, what is usually that process? Getting to understand themselves better? What are their boxes and all of that stuff? Yep.
So first off, we'd start by go to our website. That's wiredbiohealth.com, www.wiredbiohealth.com. Go on there. Read all the information that's on there. And then you can even schedule a 15-minute conversation at no cost just to say, here's what's going on with me. Is this even something for me, or point you in another direction? Mm-hmm. From there, we drop ship the lab kits to you. As I said, anywhere in the world, it's a buccal swab, real simple, right? Takes 2 seconds, put it back, mail, goes to our lab, we get it. We then create what's known as a biomarker evaluation report, where we go over each one of those particular genes, whether there's a clinical abnormality and no clinical abnormality, and then how it impacts, and then create a plan of optimization for that individual as personalized as your DNA is. Nobody's going to have the exact same anything. And then either, as I said earlier in the conversation of here's everything, have at it, here's the phases, when to start them, what to go through, or you want to work with us through this, then we have clinicians, counselors work with you through it.
Okay, great. So is psychotherapy part of the program, especially for somebody maybe going through a loss or addiction of sort? Okay.
Yep. And our therapists are trained in understanding these biomarkers. Mm-hmm. So we can kind of get to the root faster of what's happening with both teams working together. Mm-hmm. We train therapists, counselors, psychologists, psychiatrists, and here's the biomarkers, here's what they mean, and other practitioners. But it's such a great hand in hand to get there faster. And like we were talking about earlier, it's about the outcome for the individual. We're going to get a better outcome and faster probably.
Right. Beautiful. So for everybody who may have the excuse, I don't like needles, there are no needles involved.
Nope.
Absolutely not. You swab that cheek, you put it in, and it goes out. That's it. Exactly. No needles involved, so cut it out.
You know the excuses.
And they are many, you know, so many. So I, at the end of the day, this is something that I would recommend that at least everybody does the one time. You understand your makeup. You understand how those makeups affect you. It's kind of, the only thing that is really coming to mind is like a genotyping. It's kind of like that,
Yep.
right? And for women who've ever had a child, when you're pregnant, they do, blood
Right.
work to
Right.
make sure you don't have conflicting blood type with your baby. And for anybody who's ever banked umbilical cord blood or gone through IVF, or these are standard things that are kind of sort of done, but not
Right.
on that, level. No needles involved, no blood, so you don't have to pass out. It's okay. You can do it at home. You don't have to go to a doctor's office. Again, the kit gets sent to you. What does it hurt to know exactly what medication might work for you?
Right.
So you don't have to go through trial and error. Again, with diabetes, for example, how many people get started on metformin and then, okay, it's not working, let's go into injectables, right?
Yep. You can know all that beforehand.
We could have known this ahead of time without having to, be guinea pigs. I'm saying.
Exactly right.
This is great. So, Dr. Evelyn Higgins, this was such a great conversation, and I really do want us to maybe explore this a little more and having more conversations like this, because for somebody who's actively doing this and you've done your part in sounding that drum, it is not an alarm, it's a drum, so we can all kind of like focus on where that sound is coming from. What is the one thing that you would like to leave our listeners with, be it everyday healthcare recipients or healthcare practitioners?
Sure. Really, to kind of wrap up this conversation is that this is really a game changer, be it the patient or be it a practitioner, to know what your game plan is based on fact, rather than I've had X amount of successful doing it this way, or that, sure, that's part of your whole game plan, but we can have so much better outcomes and prevent so much. And really everybody plays a part in the end result being that much better. And that's kind of the idea of the teamwork.
Yeah. And the one thing that was so beautifully put. And the one thing that actually came to mind when you talked about, the outcomes, better outcomes, and everybody has a part to play in this and everybody can benefit. We talked about clinical trials, and for the communities that have had not so rosy history with clinical trials,
Right.
I cannot emphasize enough how important this is.
Yes, absolutely. Be armed with the information of what you're made up of. Absolutely. And it gives the power back to the individual.
Yes.
It can change.
Yes, even if you don't participate in clinical trials that are actively taking place for whatever therapies because of the distrust. I understand, I get it, right?
Yep.
However, you can also have a say when that therapy is released to the market for use to say, okay, would this work for me based on my DNA?
Right. There's the power.
There's the power, because something that people don't think about, and this came to me while you were talking, Dr. Higgins, is that most people don't feel comfortable with clinical trials, right? However, when the therapies are on the market and actively being used, if your DNA makeup was not part of that clinical trial, you're actually still being tried on.
Yep. You got it.
Wouldn't it help to know what works for you, what doesn't work for you?
Absolutely.
I mean, we've talked. So, I think everybody can benefit from it. Thank you so much, Dr. Evelyn Higgins. This was such a great conversation. I learned quite a bit. I'm quite impressed, and I think I know what I'm going to do next. So,
all right.
So thank you for being here. Thank you, everybody, for listening. What we're going to do, we're going to make sure that the show notes has everything about Dr. Evelyn Higgins and how to reach her, the websites, the services, the offers. So if this is something that resonates with you, you can reach out to her, reach out to the company to do your consultation. There's a free consultation. There is a free consultation. What would it hurt? Take advantage of it. It's global, so you don't have to be in a specific place to benefit from this. Have that consultation done, explore what you can. And for anybody out there listening to us, if you're struggling with any addiction and you're great at hiding it, we understand. However, there is hope. there is hope. You're not struggling alone. If you feel like you've tried therapies upon therapies with different things, again, you heard Dr. Higgins, you are not alone. There's a way we can actually see what is really going on and customize a treatment that works for you, please. It doesn't hurt to know what boxes you have in your DNA and what triggers them. So you have support. You're not alone. It's hard. We understand the judgment. Society can be very stiff sometimes. Mm-hmm. So we get it. You're not alone. So thank you. Please let us know what you think. And yeah, thank you, Dr. Higgins, for being here.
It was wonderful. Thank you so much.
Thank you. I appreciate it. All right. Bye, everybody.
Thanks for tuning in to Unshelling Medicine Podcast. If you want to stay up to date with the latest episodes, make sure to hit that subscribe button on your favorite podcast platform. If you enjoyed today's episode, please take a moment to leave us a review. Follow us on social media at Altruistic Scribe on Instagram, TikTok, Facebook, YouTube, and LinkedIn. We share additional tips, updates, and health-related content that you won't want to miss. Have any questions or topics you'd like us to cover in future episodes? Reach out to us at altruisticscribeco.com. We're always eager to hear from our listeners and tackle the health topics that matter most to you. Until next time, stay healthy and take care.